During sleep bruxism, the upper and lower teeth may come into direct contact as much as 40 minutes per hour. According to research at the Tufts University School of Dentistry and Pain Center, the back teeth, or the molars, are experiencing a force of more than 250 pounds of pressure. It's much like having a large football player standing on your teeth. And this is actually 10 times more pressure than when the average person chews food, which is about 20 to 40 pounds of pressure.
Although bruxism may be at least as old as the Bible, the scientific causes of teeth grinding are unknown. We do know that the condition can worsen with stress, menopause, menstrual cycle, smoking, alcohol, and caffeine. Dr. Ellis recommends hard night guards for a patient who grinds teeth. She takes teeth impressions and sends them to a lab to be custom made for each patient. Other things that can be helpful are getting regular sleep and trying relaxation techniques like yoga and gentle exercise.